Okay, so I know we're not on the chapter about like mental health or anything. I just wanted to go over some of the stuff that's in your guys' packets that I sent, which Tequila, I'm sorry I didn't send you a packet. Um, but yeah, this is just basically what's in the packet. I wanted to go over with you guys how to kind of bring this up to a patient and how we total the scores and everything. So, this first one, it's a mini mental status exam. This is what we do to see if someone, kind of to help rule out dementia or Alzheimer's, or to kind of see what stage they're in. So, down on, you'll usually have like 2 pages, and the second page is going to show you the instructions for it. So, and then it'll tell you here too, if the different scores, if it'll tell you based on their score, if it's abnormal, like the different ranges, if it's mild, moderate, or severe dementia or Alzheimer's. And the way that you want to do it, so up here, you see that you have a score of like 5, and in here, the questions, this is like 5 different questions. So the year, the season, date, day, and month. So let's say they get, the year, the season, the month, but not the day or the date, then that would be a total score of 3 that we'd put in there instead. So anything, like if it's a multi-question type thing, then you would put, like if they got, 1 or 2 wrong, you would just reduce that amount there. But so when you bring this up to a patient, because sometimes people, they are like either in denial that they may have dementia, or um, they they're afraid to be tested because if they answer wrong, then they're going to be diagnosed with dementia when they feel like that could be an incorrect diagnosis. So sometimes this can be kind of taken like with like they might take offense to it or anything. So the way that I just explain this to a patient when they come in a room is that the doctor wants us to just check, where their mental state is at right now, just to see, this is just a baseline, sometimes is what we can tell them. I always tell them some of these questions might seem kind of silly. If you get a couple wrong, it's not going to mean that you are going to be diagnosed with dementia or anything. But we just wanted to see, currently where you're at. A lot of times with patients that are older, they're probably not going to know exactly like the day or necessarily the date, because if you're retired, why do you necessarily need to know? So those are the 2 that most commonly get answered incorrectly, but are not a big deal. But you always want to just, essentially you just phrase it exactly how it is in here, so asking them, what is the year? And then instead of asking, what is the year, season, date, day, and month, you just separate it, what is the year? Let them respond. What is the season? Let them respond. What is the date? Let them respond, and so on. So just kind of like this same one here. So this one where it says hospital or floor, that can kind of be confusing. So I asked them, what type of building are we in right now? So they could say clinic or hospital, whichever one they kind of, both would be correct. So, and then asking them like what level we're on. So are we on the first level, the second level, the third level, so on, like that. So, this next one here, where it's saying to name 3 unrelated objects. So the most common one that is used, and it's not listed in this specific one, but a lot of the MMSEs will have, like 3 unrelated objects for you to state, which is usually apple, table, and penny. So you want to make sure that you say it clearly and slowly for them so they can hear all 3 of them. So you'll just tell them, I'm going to name 3 unrelated objects, and I want you to repeat all 3 of them back to me. So again, I'd say apple, table, and penny. And then if they miss one, again, you just reduce a point. And then this one where it's, you have 2 options with this one. So they can either count backwards from 100 by 7, or they can spell world backwards. I usually just have them spell world backwards because I have a hard time with that myself too. So yeah. So yeah, I can't either. That's the thing is like I always have them spell world backwards. So here's where it gets a little bit confusing because they might spell it, I don't know. Um, but they might spell it like DRLOW. So because, it's not, it's the L and the R are switched, then you would just take off 2 points for that. So if, let me pull up an example here actually to show you a little bit better. So we want them to, whoops, spell world. Oh my gosh, if I could spell, we want them to spell world backwards. So let's say they do D-R, or D-R-L-W-O. So everyone that is not correct, so because obviously it would be D-L-R-O-W. So basically you would be taking off 4 points because the D is the only one in the right spot. Or if they did D-W-O-L-R, again, you would take off every letter that's in the wrong spot. So if they just did D-R-L-O-W, oops, you would just take off these two because those two are not in the right spot. Does that make sense? Okay, just want to make sure. Okay, let me go back here. Okay, the next one down, we always have them repeat that 3 unrelated objects. The apple, table, and penny. And then if they miss, 1 or 2, then you just take away those points. So, I mean, it's pretty simple and straightforward with these tests. So this is like the total possible score that they can get out of each one. And then you'll just put your total. So, maybe this one they got 3 right. Maybe this one they got all 5 right. Maybe this one they got all 3 right, but then when they were called, they only got 1 right. So anyways, you would then mark as you're doing these questions, what their score was, and then put their total here. So just basically adding up, because it's a maximum score of 30, and then whatever they got wrong, you would just subtract from 30, and then that'll tell you their total score. So then it can show us down here, if they got 20 to 25, they may have mild dementia. 25 to 30, they may not even, it may not even be a diagnosis of dementia or anything, because again, if they miss like the date or something, that's not a huge deal. So, but this is what the doctor will use just to kind of make sure, like they may come back 6 months later and we may do this test again to see how they've progressed, because maybe they were, the last time we saw them, they scored a 23, but then this time they scored a 13 or something. So that'll tell us like how quickly their dementia stuff is like progressing. Okay, let me go to the next page here. All right, so when you have a patient that comes in for anxiety or depression, we always give them 2 forms. It's going to be the GAD-7 and the PHQ-9, which the GAD-7, generalized anxiety disorder, and it's because it has 7 questions. So that's why it's called a GAD-7. And then I'll go over the PHQ-9. So you'll usually give both of these to the patient together when they come in. These have to be done, if they have anxiety and depression, depending on their score, they have to be done either every time that they come in for a follow-up on their medication, or every like 6 months. So if they score like a high number, like they're pretty anxious all the time, then they'll want them to have this done at every follow-up to see if it's improving. But if they come in, like say they weren't supposed to, they did score a little bit, they're coming in for a follow-up on their medication, I would give it to them to do anyways. But if you ever see that someone's coming in for anxiety and depression or a follow-up on that, you want to give them these forms. So, but I always explain to them, even though it does say like right on the paper here, you know, over the last 2 weeks, have you had any of the following problems? So just kind of reiterating that it's over the last 2 weeks, not if you've ever had this. We want to know like how they've been feeling recently. So um, we would give this to the patient for them to fill out themselves, and I would let them, you know, go leave this in the room for them so they can fill it out in private, instead of asking the questions to them, because sometimes those people kind of feel awkward, like, you know, saying nearly every day that they're becoming more easily annoyed or irritable and stuff. So you would leave this in the room with the patient, as well as the PHQ-9, which is Patient Health Questionnaire, and it's 9 because of 9 questions. So um, again, this is a over the last 2 weeks type deal. So again, reiterating to them, you know, this is just how you've been feeling over the last 2 weeks, not just like if ever. If the patient, which is down here, the last question, hold on, let me see what that. Yeah, I mean, sometimes people don't necessarily answer it honestly. So that's the part that's difficult. Um, you want to express to them, you know, like we want them to answer honestly because that'll help us help them. And it's not that we're going to like judge them or anything. Um, you know, we just need to know where they stand so we can make sure that we're getting them, you know, the right and adequate amount of help. Usually they will answer it honestly because if they're coming in because of anxiety and depression, they're pretty much like ready to accept help. But that is kind of difficult because, I mean, potentially they may not be telling the truth and we don't know for sure. But I mean, the patient, this goes into their chart when we're done with it, and the patient does like initial it as well. So if for some reason they try to come back and sue them and say like, you know, well, I was going to a doctor and telling them how I felt or whatever, and then we could pull this up and say, the last couple of times we've seen you, you've said that you weren't having any of these symptoms or anything. So sometimes they give these for like physical exams or if it's like an initial appointment, um, because it's like a baseline. But the main thing is this bottom question here where it says thoughts that you would be better off dead or of hurting yourself. If they answer like nearly every day, really any of these, several days more than half days or nearly every day, that's something you want to let the doctor know right away. And then also asking them to, you know, like if they're currently having those thoughts, if they've had a plan that they've, you know, created or anything, if they have, you know, done anything so far, if they have injured themselves or had thoughts of injuring others or anything. So you'd want to let the doctor know right away. So that way they can, you know, we can decide. It doesn't necessarily mean that they're going to be admitted into the psychiatric ward of the hospital or anything. Um, it's something that the doctor's going to discuss with them, but we don't want them just hanging out in a room by themselves when they've, you know, been having suicidal thoughts. So, um, again, this is the same way though, where like they answer, you know, say they circle a 3 here, a 1 there, a 0 here. You know, you're just adding these numbers up, and down at the bottom page, it'll tell you like what the severity is here. So, and depending on the severity, then you would say like how often they need to come back, or really the doctor will say, you know, like I want to see you again in 3 months or 6 months. Usually it's at least every 6 months for medications like this. We'll want to see a patient. So that's where it'd come into play because you might have to put in like the recall that says, you know, like send out a reminder to the patient in 3 months for a follow-up appointment. So, but these really help the doctor just so they can tell, you know, like initially maybe they came in for depression or anxiety, or they were coming in for a completely unrelated issue, like you said, Tahila, where they had given you these forms, because sometimes patients they're not ready to like accept help, so they don't want to say that they have this issue, but then sometimes, answering these questions can help us get, to the bottom line of what's going on, what's causing their issues and stuff, and we can help them with that. But, huh? They do, yeah. Those are usually, like, that kind of medication, they usually follow up with a psychiatrist on. But yeah, there is a form for that too, which, just depending on the doctor that you work with, if they do that, every time they come in for a follow-up on that medication, they'll give them this checklist so they can answer, because then we want to make sure, like, say we've started them on this medication, and then their answers 3 months from now are really not much different. Well, then it doesn't seem like that's really helping. So let's see what we can do next. So, or it's getting worse, or it's getting better, and we're good, and we'll just keep you on the same regimen and follow up with you, 6 months from now or something. So it really just helps the doctor to know, are they having more issues with anxiety or more issues with depression, so they can prescribe them the right medication to deal with that specific issue. Oops. But to answer your question, Tahila, about the last question on the PHQ-9, thoughts of self-harm or anything, you would report it to the doctor, and the doctor will go over some questions with them, which if you feel comfortable to go over questions with them, such as, like, do you currently have a plan in place, or have you, that's like the most common question, is if you have a plan in place, how severe are these thoughts? Have you, acted on any of these things? If you feel comfortable asking those questions, but you can leave that to the doctor and let them know so they can ask them those questions as well. So, but I think that's one that patients are afraid to answer, because they feel like if they answer yes, that they would be admitted to the psych ward or something, which isn't necessarily true. So yeah, if you see any, like, fresh wounds or anything, you'd let the doctor know as well. I mean, like, obviously, like, it was something recently, so, like, red and scabbed over and whatnot. So yeah, you definitely would want to let the doctor know right away, regardless if that's what they're coming in for or not. So, because if you notice something like that, then, like, sometimes they'll wear, like, long sleeves, but you need to take it off for their blood pressure and stuff. Obviously you want to act normal. You don't want to, like, freak out, because then they're not going to really feel that comfortable. So, but you do want to let the doctor know, like, hey, I noticed when I was taking their blood pressure that they had these scars on their arm, or, like, they look like pretty fresh wounds. So they would address it with the patient. So, but again, if you feel comfortable asking them questions, so you can get the information for the doctor, most doctors are okay with you doing that. It's going to depend on your relationship with your provider. And sometimes asking them, like, are there specific questions you want us to ask this patient? Because there's times where I don't realize there's certain questions I don't know that the doctor would ask, or that they come up with that I'm like, ooh, that's a really good question to ask someone. So but any questions so far, Tahila? Oops. Okay, cool. All right. And then once you are done with these forms, of course, you're going to give them to the provider to look at during their visit, which the provider will then give back to you. Because there's either going to be a section in their chart where you can enter this electronically, or you'll just get it scanned into their chart. Or maybe sometimes both. But that'll definitely help us, so, to know how soon they need to follow up. So when the doctor's done with them, we can say, like, they should follow up in 3 months because their score was pretty high. And we want to make sure, they come back sooner rather than later, so we can keep up with their mental health. Because, I mean, the last thing we want to do is send someone out with anxiety and depression and be like, all right, see you, whatever. So, I mean, the goal is to make sure that's well controlled. So seeing them, depending on how severe it is, it might be a month, it might be 3 months, it might be 6 months. But we want to make sure we keep track of these so we can tell, like 6 months ago, they had a much higher score and now they're feeling a lot better. Or, they've been on this medication now for 3 months and they're not really improving that much. So then they can determine, like, let's change some things around or whatever they need to do. So, but yeah, any questions or anything? No? Okay. All right, well, that was pretty much it for today. And I'm gonna record another lesson to post, which obviously, this is going to be a short week because of the holidays and stuff. And oh, I didn't do the riddle. Did you guys have any guesses for the riddle? Yes, it is a turkey. Yes. Okay. All right. Huh?
You got it.
Yeah. All righty. Well, we're gonna close this today, Tavila, and then
Hi, Tamila.
Darlene says hi.
Yeah.
Oh, it's over here. Over by me. There she is.
Happy Thanksgiving, Tamila.
Hi, everybody. All right. Well, I will, obviously you don't have to, Thanksgiving is Thursday, so you don't have to watch the video Thursday or anything, but I will be posting another lesson to review later on this week, since we won't be having our normal stuff on Thursday, so. But all right, thanks for joining. Have a good day.
Yeah.